potential spin.
Would you like me to lean or?
Okay, let me shift this a little bit more.
There you go.
There we go. Hi everyone! My name is Natalie. I'm here with Dr. Miriam Bakhtiari, and we have Dr. Haas off to the side. And we're here to talk about BLA Fit. Dr. Miriam, but before we get into that, I want to introduce Dr. Miriam. And she's a board-certified dentist with over 28 years of experience specializing in TMJ, orthodontics, and sleep apnea. And through her research, she discovered there's a powerful way that we can exercise our facial muscles and ultimately benefit us in the long run by plumping up our lips and lifting up our cheekbones and really chiseling out that defined jawline that we all strive for. And so what really fascinates me is that there's really a lack of education in exercising our facial muscles. We all know the importance of exercising our body. A lot of people go to the gym. A lot of people have gym memberships. But I didn't know that we could actually exercise our facial muscles. And you saw that there was a lack of education in this space. Mm-hmm. And you decided to invent a powerful tool to really bring more awareness to this. So can you let us know, why is it so important to exercise our facial muscles? Like, what are the benefits that we're getting out of it?
Sure. Thank you, Natalie. Hello, everybody. I'm Dr. Miriam Bakhtiari, the inventor of Lip Appliance. Natalie, I think we're just socially and in our society are really geared toward, we learned as we were born that exercise is good. Mm-hmm. We learned that in school we had athletic classes, so we were introduced to athletics and sport early on, and then since 1980s we've been introduced to aerobics, gym membership, and that's becoming more popular. People now, even more than before, on Instagram you see people are like really specifically targeting certain muscles in their body, that they want bigger glutes or they want, whatever they're looking for, female and male. But our society, as we're growing in we're becoming more and more in every way developed, we're forgetting that there are muscles in our face too. Our whole body from head to toe is covered with muscles, and it's one fascia. And why we're not working out our faces, I think, is because our society and our medical community always has fast answers to problems. And we learned that plastic surgery years ago, your great grandmother maybe had facelift. The solution for face sagging was facelift. Then once the injectables came in, it was okay, we can do so much with injecting. We can sculpt the face, we can lift, we can do all that, all those treatments. But you know me now for the last few months.
Well, I've known you for a couple of years now.
Yeah. Well, Natalie was my patient years ago, but you know that I always lean toward non-invasive.
Yeah.
And I'm always looking for ways for my own health and well-being, ways that I can do things non-invasively. Like, I gear toward non-invasive, holistic approach to most things. And nutrition plays a big part of our wellness and health. And
absolutely.
It is also a part that's missing in our society the last, I would say, 20 years. Living a fast life. Our society here in US and in the rest of the world, we're so fast mode. We go here, we have like 10 minutes lunch. Nobody's sitting in the park, like in the movies, Pretty Woman. They went and sat in the park and they took their shoes out. We don't have that time during our work schedule. It's so much to do, and we're always running behind, trying to enable ourselves to meet our daily agendas. So we're not eating a wholesome food and chew, and at the same time our culture has become more cooked, more processed. We're becoming more westernized, so that part of our society has helped deteriorating facial muscles, because our jaw and our teeth are geared toward chewing hard, wholesome, raw food. And when we're not using it, soon with the evolutionary process, we'll become more maybe flat faces, and injection is one way to enhance that beauty, but I feel like if we would somehow target those muscles and specifically work certain muscles in our face, we are able to actually get better results than injections because it's more natural. And it's something you're doing inexpensively, and it makes you feel good that you're doing something rather than injecting and doing harm to your body. Because injections is just a short-term fix to a big problem.
And they also require consistency. You can't just inject once and expect to look like that forever. You have to go in and boost it and then get more injections.
Yeah. And we're looking at many injections. I mean, the needle goes to many parts of your face to be able to, they come in and out. So each of those injections can create an infection. Each of those times could be an area of causing inflammation and trauma. So and like you said, it's not something you can do today and tomorrow you'll be free. It actually requires high maintenance. It's a high maintenance treatment, and once you do it, forget about expense. It's that they're starting kids at age of 16 now. 16, 18-year-old. Imagine how long you're going to keep that up until 60, 70, 80, how many? I mean, we're looking at every 3 to 4 months of touch-ups. So I think that, I don't know, I'm not against it. There's people that really are older and may need that. But personally speaking, I'm not looking for things like that in my life. I'm 54, we just celebrated my birthday. And I'm not looking for injections as a solution for any of my facial problem. I work out my body, I walk, I eat healthy, and this is what I do for my face. And when I came up with the idea, it was all about how I mean, I've created many custom-made orthotic devices for different needs. What can I do? How can we anchor in the facial muscle, anchor around our lips to be able to trigger certain facial muscles? And that requires certain expertise and then exercises. It's not something that I can give you and you take it home and I say, okay, that's it, done with it. You have to be trained in order to be able to get those muscles triggered. There's a certain way of doing it correctly.
You're like their personal coach, right?
Yeah.
Their personal trainer.
Yes.
Yeah. And so can you demonstrate to us what these exercises are and how they're targeting these muscles?
Yes. So there typically our exercises are 2 exercises, that what we call horizontal exercise and vertical exercise. There's so much more, but our basic exercises are entailed in 2 exercises. We want to do at least minimum 5 to 6 repetition of each exercise, slow motion, to be able to, with a slow movement, you're actually activating different muscles. We have over 50 muscles in our facial structure. They're smaller and they're connected. So if you could connect them somehow correctly, you'll be able to plump them, lift, and also treat and not harm TMJ. I don't know if you know TMJ or not.
Can you explain to us what is TMJ?
Yeah, TMJ is temporomandibular joint disorders. I know we all know or are one of the patients that has TMJ, patients that have jaw clicking, jaw locking, jaw pain, headaches, ear issues, and facial muscles in the morning are due to clenching, is really super tired, and migraine. And these patients, if we're targeting them, because we can't eliminate and say, okay, so who doesn't have TMJ? I would say over 85% of our population has TMJ.
Wow.
Some of us know, some of us don't. So we can't target those patients out from Bella Lip Appliance. So what we have to do is, as a TMJ specialist, the exercises have to be geared in order to be able to lift your face, but yet treat and help the temporomandibular joint. So we're not doing something and harming another. The area of TMJ, Natalie, is very important geographic area in our body, is because right behind our lower jaw, the extension of lower jaw, if you guys all put your hands in front of your ear and open and close, there's a bone that moves when you do that, when you open and close.
Oh yes.
That ball area of the lower jaw, right behind it, you have the major blood supply nerve and artery that pass through the brain. And you cannot put something in your mouth, and I have the diagram here. You cannot put, I'm going to come close by. This area is called TMJ. You cannot exercise this and harm this area because you may work out your facial muscles, but now you have headache, migraine. You're actually pinching the biggest organ in our body, circulation to our brain. So it is very important for people to know that specific exercises has to be done to work out your facial muscle. We have Dr. Haas here, and he has to go from the other way. We have Ryan. It's in the other side, doctor. So you have to specifically work out the facial muscles, yet not create TMJ. So we have another scientist joining us, future Dr. Patel. So I'm gonna have.
Hi guys, hi everybody. Sorry, I'm joining in late today.
That's okay. So Ryan, future Dr. Patel, is one of the guys that when we did our first clinical study, was involved in our clinical study with us. And we published a study this last January on International Journal of Orthodontics, and proved using BLA for 1 minute a day, we'll be able to lift and plump your lips about 14%. Just 1 minute a day of this exercise. Now you asked me how to do it. Did you want me to show it actually?
Yeah, absolutely. I think people don't really understand it when they look at this and they're like, how do I use this?
Yeah, it is a simple device. And the reason it's simple is because we wanted it to be simple. I am very, I like things that are simple and they're hygiene. And originally when I was drawing we were making the prototype, we worked with an aircraft engineer, and my husband, Dr. Sadeghi, here sitting. When I talk, nobody else talks. You ask me a question, and I not stop going.
Very clear.
Yeah.
It's my teaching part. I have a passion about teaching and educating, and when I, just off the subject, when I see consultation patients, Olga, my office manager, takes me to the room and tells me you only have 45 minutes. And I go in and I want to learn about the patient's wellness and health and history, and it takes time, and I want to educate them. I want them to understand what TMJ is, what's going on, so that they can be their best advocate in life. And so that's a part of me, and then the team comes and says, you're backing up, you gotta go. We gotta get the traffic light going. So it's a part of me that wants to teach, and I'm worried about missing any part to the public, because this is something, Natalie, that not people are aware. They're not aware that there's many products in the market right now, and they're all aimed to the lip enhancement, facial enhancement, exercising devices, but those guys are not backed up data showing that if you do those exercises, what is the harms to our jaw joint? Are we plumping the lip by trauma suctioning cups? I mean, those products may work short time, but you're traumatizing your tissue. I have an immunologist sitting next to me. He'll tell you he would never allow me to do something like that on my daughter, because you're actually suctioning the lips. And by that, you're inflaming the tissue and it swells up. I mean, I don't want to look good by inflaming my tissue. I don't like self-sabotaging personally. But I feel like we're selling products in the market, Ryan, that people are really harming themselves, and the result is because my lips are bigger. I mean, how far are we going to go for our beauty and wellness?
Yeah.
I mean, I think we've gone way too far already, and I don't want my daughter to be one that starts that at 16 and harming her lips. I can't imagine. By suctioning, you're doing two things. Number one, you're stretching the tissue. Number two is you're creating a lot of inflammation in the tissue and swelling up. What are we going to do? The next time, after 1 year, do we have clinical data showing that what happens after 1 year to the tissue? How much saggy is that lips going to get? And is that going to have harmful effect? I'm going to actually look to you to say what your thoughts are.
I think any exogenous product that goes inside human body, it triggers immune response. No matter what. Even you inject water inside the skin, that will trigger immune response. It stimulates the immune system, and the activated immune system equals inflammation and scarring.
Yeah, scarring. That's another thing that I
So,
forgot.
You don't want, you want to avoid it. You want to do anything non-invasive,
Right.
anything but exercise, and that takes
Yeah,
time.
so that's it. The when
It's
I
not a quick
quit.
fix.
Yeah,
Yeah.
it's quick fix
It's not
is
quick
not
fix.
going to be.
No such thing, right?
Yeah. Well, we were at the beach yesterday and there was a nice lady walking and we looked at her back and she had fat injections in her behind and it really didn't look natural. And I think some of us are putting our head underneath the sand and we're exposed from the back and we think nobody can see us. Really, I think injections and redundant injections and facial enhancements have gone beyond normal limit and people think they look really aesthetically pleasing, but not to me. When I see them from 100 miles, I know that they had lip injections, they had eyebrow tattooing, they had cheek fillers. We're doing way too much, and we're going away from self-confidence, self-love, self-care, because we're doing something that, in my opinion, as a woman, I feel like I gotta do all of this so that society can accept me, that I have big lips and I look like certain people.
Yeah.
But in reality, we're again, I like the sabotage, because we're just self-inflicting pain to ourselves, because the more we do that, when we don't have those things done, the more we feel less of ourselves. Do you agree with me?
Yes, and I'd also like to point out that beauty standards are kind of like fashion trends. They go in and out. Like 10 years ago, women did not want big bottoms, right? They wanted large breasts, and now that's like a trend that women don't want large breasts. They want bigger bottoms, and so women are like, it's always going to be challenging to like fit these beauty standards, and you're never going to reach it. It's always going to, like, this goalpost is constantly going to be moving,
Yeah.
and so therefore it's just better to just accept yourself.
Accept yourself and enhance your best beauty. I mean, I cannot look like my sister, who is born in the same genetic found, right? You don't look like Ryan, your two brothers.
Right.
My husband doesn't look like his brother. There's some genetic resemblance, but I cannot even look like my own sister. And it's going to be hard for me to try to catch up with people and look like certain individual. And how far is our society approving us to go through that route and look like somebody else? I mean, I feel like we're becoming all kind of not real.
Yeah, like
I don't want to say negative word, but it's not real. I mean, with all the makeup and all the enhancement, I mean, I get it. As a young girl, you want to put a little bit makeup, but I think when you go beyond that certain level that you don't look like you anymore, it's dangerous, because that you're telling the society, I don't like who I am. I want to look like this because that is my idol. To me, there's something wrong there, and we need to work on educating and empowering women to know that they are beautiful however they are, male, woman, all of us, we're beautiful the way we are, short, tall, big, small, but we can be the best version of ourselves. I cannot sit down and not take care of my health and wellness and say, oh, that's the way I am, I'm this way. No, I will eat right, I will exercise, I work on my mental work. I'm doing still trying to get better every day, but at the same time, face is no different. So I think that specific facial exercises with resistance, and I'm not literally talking about BLA Fit, but I will tell you, I guarantee you with my life, I educated myself what's out in the market before I created this. There is nothing like Bella Lip Appliance, because none of the products in the market are made by brain. I mean, a doctors that know about muscles, doctors that know about jaw, and everything else. I mean, you don't have to buy anything. You can get a piece of the balls that you do your muscle exercising your hand that they give you free in all the events, put it in your mouth and clench on it. You'll be able to get some sort of a different differentiation of your muscles and plumping, but you're actually using your clenching muscle and making it bigger, and it could create more impingement on the blood supply that I showed you, and more headaches, and possibly jaw locking. I mean, we're treating patients here from jaw locking, from anywhere from oral sex to using these type of products. I mean, we know these things are possible, and I'm here to treat them. And it costs them $3,000 to $5,000 to get treated. But why are we allowing companies that didn't think and putting something in such a dangerous place where you've got blood supply to your brain and there's a possibility of that being impinged, I would think second time before I buy anything in the market, unless it's done by somebody that actually has clinical study behind it, has research behind it, has her life on it. This is my life. The exercises for just 5 or 6 repetition, and I haven't even done it yet, will show you that once you do it, I guarantee you feel the difference immediately with the muscle getting the workout. The difference is our facial muscles are so much smaller than the rest of our body, so much less needed to be able to plump him, but there's a specific way to trigger them. And that's why when we sold the belly lip appliance, remember you and I were talking about it last year, we learned that in order for me to make sure you're doing this correctly and making this your lifestyle, we need to train you.
Yes.
And at this point, if you're buying it, we still have time slots that I will meet with you one-to-one for a few minutes to show you what's the best exercises for you. But if I wasn't, there will be team members that are certified that they can teach you how to do it without learning. It's kind of like I give you a yoga mat and say do yoga and stand on your head and do whatever.
Right.
You need to have that education and learning process, and then once you get it, then you're on your own and you can make this your lifestyle, and you will see that this is going to be preventative for younger individuals like you guys. It could keep my face the way it is for longer, and it's not, you told me what is the benefits of it. When you exercise the facial muscle, you're actually increasing blood supply. You're getting the muscles to pump. And when they pump, you're actually increasing blood supply, circulation, your own collagen formation. You don't need so much cream and serum because you're actually doing it. And if you do it in the morning and at night, you will see the difference in your skin, blood supply, circulation. And if you do it correctly the way we teach you, you will reduce your headaches, you will feel much more calmer in your jaw, and you will be feeling more like yoga, like more centered and happy, and it's relaxed, and it's self-care. It's self-care.
I love that.
Yeah, we'd love to see it.
I know. So Ryan is telling me, Dr. Mariam, show it.
Yeah.
So this is belly lip appliance. It has 2 arms and a perfect resistance here, kind of like weights that this carries, that Dr. Haas, me, an aircraft engineer, designed it. We've done. So here it is. The horizontal exercise is to lift the corner of the lip and lift your cheekbones. There is no other benefit. There's not going to affect your jaw or anything. So what happened? Are we back on?
I think we're back.
So here it is. Again, you have to be trained on it. It's an ah sound. And we're going to move the corner of the lips slowly together, 5 to 7 repetitions with the breath in and out. We're going to make this exercise not only for beauty, but for wellness. You can feel the engagement of the cheekbone muscle with this corner. As I'm working it out, I feel the lift happening here. Now this one is for the TMJ. It's for the lip plumping, jawline, and also tightening your airway muscles and your jowls. So here we go. As we're bringing the lips together, we're moving the lower jaw forward and releasing the blood to the head. So we're increasing the circulation. You can feel all the engagement of your facial muscle, your cheekbones.
We
You
also
feel
like
that?
to note that no teeth are being involved.
Right.
There's no teeth involvement, so if you don't have teeth, if you have braces, that has nothing to do with this exercise. But one thing I can tell you I feel right now is because I took the breath in and I allowed the oxygen to get to my brain really feels relaxed right now. It's hard for me to talk now. You can hear it in my voice. And you can hear it in my voice all the time. It's kind of like you had a helium balloon in your mouth and you can't talk. The main part of this exercise, as we started selling it, we didn't know that we're learning more, is the part that it actually taps into parasympathetic nervous system. And that's something that we're missing. We're all day long clenching and running for our life. Imagine an exercise that you can only do 5 to 7 times that also taps into parasympathetic, increases blood supply to your brain, to your body, and engages your mind to get away from all the thoughts that's happening. Engage with your breaths. That is, I think that's...
Speaks for itself.
It speaks for itself. You can't put a value on it. And just a quick thing is this product is durable. We're not looking at, we didn't want to have something that is in the market that you use it for a month, you pay us $30, $40, and then you dump it in the corner because it cracked, broke, and I give you 10 days warranty. My name, my 30 years of profession, I have 3 diplomats in my field. I have an MD, PhD next to me. I have a medical student, and I have the smartest lady sitting next to me here, that we know that this product, we wanted something that you can have and it lasts you long. The products that I make, the appliances I make in my practice, they're all durable. I didn't want to give something cheap. That's why we had to make it in USA. In order for me to be able to keep an eye on the manufacturer that does my dental products, I had to make this in USA, and it had to cost me a little bit more because just the way it is. If I made
free.
And we tried, according to my immunologist husband, the product has to be FDA colors, FDA plastic. We wanted to have everything on this to be durable. That's why you can do this. We did a testing. You can do this exercise over 400,000 times. They did it with machines that did it 1 second per minute. It wasn't even the jaw. It was much stronger. It didn't crack. And it was able to it started having minor crack after 400,000 cycles.
Wow.
This shows that this product, the technology behind this, it's very durable. And if anybody copies these, I promise you, after 1 week, you're gonna have to dump it out. And they sold something cheaper. And you're getting the product, you're getting my time, you're getting a supply, an oil supply for what you're getting. And the reason we didn't make it so expensive is so that you can have it, so that your daughter can have it. Remember we talked about Dyson and other products that are expensive?
Yes, they're really expensive. The Dyson is like around $500 for a blow dryer.
No, $800. Blow dryer is about $500. No. I'm not saying anything against the company, but I'm saying that we're spending way more than we should on products that are not, it's going to do something to our hair that tomorrow washes out. You're doing something to you that stays with you. You're making a change in yourself that is to stay, to rejuvenate, to make you feel good, to make you relax. All the benefits, and it's not something that I'm just going to put some supply in my hair and tomorrow it's going to wash out. It's something that it stays with you. That is something, I don't know how to explain it.
It's about investing in your health.
Yeah.
Investing on yourself and your health.
I read a very nice quote that was about the best investment you can make is an investment into yourself. And I think that with BLA Fit, that really truly does that. When you were talking a lot about kind of the oxygen benefits of taking that in, and I think it was so interesting to see your demo too when you were breathing as you're doing those exercises. I think it leads to a whole lot of great mental benefits too.
And we know now with Sylvia that we have a very yoga master that is actually taken the BLA into a different dimension. She reached out to us a few years ago when we just started marketing our Bella Lip Appliance, and she came to my office and she says, "Can I interview you?" And we made a Facebook interview, and she just sat next to me and put her camera and asked me, how did I think about this? Because she says that for years she's been looking for something that can do the 2 exercises, because she teaches about pelvic floor and the connection with our mouth and our vagus nerve. And she actually now taken this to a different level since then. And now she has 8-week courses, 6-week courses, 4-week courses that she actually teaches you the right way to engage your muscles with your pelvic floor and release your occiput pain. To even better than me, teaches you how to take the breath in. Her courses are inexpensive. She has the 4-week courses, I think, for $30, $40.
Oh, wow.
You can get the pre-videos and work with your BLA. So she actually takes BLA to a whole different dimension, which I'm going to attend as well to learn. But just the basic exercises does so much. Imagine how much more you can build on.
Mm-hmm.
Wow, I love that. Well, thank you so much for having
You're so
for
welcome.
being here and explaining BLA. And I really think it's a great.
Yeah.
Like
I
it's
do-
right next to my bedside.
Yeah.
Do the jaw forwarding, Ryan,
Mhm.
and then when you sleep, your jaw feels. In the morning, you wake up, you don't feel clenched anymore. It's just such an experience.
I think it's time for our next live.
Okay. Is that the next slide?
Well, it's
Yeah,
not this one, but thank you guys.
Thank you.
Thank you.
Bye,
Bye.
guys.